Have you ever wondered why some women seem to have a smooth pregnancy while others struggle with constant discomfort, stress, and healthy challenges? Pregnancy comes with many changes, and if you don't understand what's happening to your body, even small normal symptoms can become frightening. Pregnant women worry when they are experiencing constant tiredness, morning sickness, back pain, mood swing, swelling, or difficult sleeping. Some even start asking themselves, is this normal or is there something wrong with my baby? Now, the good news is that many pregnancy related challenges can be managed. So, in this video, I'll be sharing some of the most common problems pregnant women face and practical solutions that can help make your pregnancy journey smoother and healthier. So, let's get started. Hi, my name is Heavy from Avis Med Zone. I'm a health content educator. First one is constant tiredness, is extreme fatigue. Many women says I'm sleeping enough, but I still feel exhausted. Now, why does this happen? Your body is working over time. You are producing more blood, supporting your baby's growth, and experiencing major hormonal changes. And what can help is when you try to get enough rest, when you drink plenty of water, when you eat iron-rich foods like beans, fish, meat, or vegetables, and when you attend your antenatal appointment, because severe tiredness may sometimes be linked to anemia. That's a story for another day. But remember, your body is not lazy, it is building the baby. So that constant fatigue you're experiencing, constant tiredness you're experiencing is normal. So another problem you might encounter is morning sickness or vomiting. Many women expect pregnancy to be exciting until morning sickness start arriving. And when they smell the food they love, it will be irritating, and others feel like they don't feel like eating. So this happens mainly because of pregnancy hormone. And what can help is small meals or where you avoid things that you know that can make you vomit. So the next one is back pain. As your baby grows, extra weight places pressure on your back and muscle, and this can make standing, walking, or even sitting uncomfortable for you. What can help is when you maintain a good posture, you wear a comfortable footwear, when you avoid lifting heavy objects. That period you learn to avoid lifting heavy objects, and when you engage in pregnancy safe exercise approved by your healthcare provider. The next problem you may encounter when you have swollen feet or legs when you're pregnant. So many pregnant women become concerned when they notice that their feet, their shoes, they feel tighter, might swelling around there, because pregnancy causes your body to retain more fluid. That is why it's happening. So what can you do to help yourself? You need to avoid standing for a long period of time. You need to elevate your feet. You need to stay physically active, and you need to drink a lot of water, and you need to still urinate regularly. However, if swelling continues, becomes sudden and severe, especially alongside with headaches, vision changes, just better contact your healthcare provider immediately for them to advise you on what to do. So the next problem is mood swing and emotional stress. 1 minute you're happy, the next minute you're crying, the next minute you're angry. I know it sounds familiar with early stage of pregnancy, please. Now, pregnancy hormones can affect emotions. Maybe if you're worrying about your child, I'm going to become a parent, what do I do? So how can you get help? You need to talk about your feelings. You need to spend time with a supportive family, anyone that is a supportive family to you. Talk to them, clear your mind. Don't hesitate to seek for professional help. If you're feeling overwhelmed, you can talk to your doctor. Take care of your mental health. Taking care of your mental health is just as important as your physical health. So your next problem that you may encounter is difficulty in sleeping. Many pregnant women struggle to sleep, especially as the pregnancy advances. This one I'm talking about is like from 6, 7, 8, 8 to 9 months. Okay, so you notice frequent urination, your body discomfort, anxiety, an active baby contributing in your tummy. So what are you going to do? You need to sleep on your side. If advised by your healthcare provider, that's what they'll tell you to do. Sleep at the side, use pillow for support. Basically, you're not going to feel comfortable. Avoid heavy meals right before bed. Create a calm bedtime routine, and a good sleep can improve your mood. If you're upset, just go and sleep on it well. You're going to feel okay. So what are the next problems that you may encounter when you're pregnant? You may encounter high blood pressure. Now, this is one pregnancy problem that should never be ignored, because high blood pressure can increase the risk of serious complications for both the mother and the baby. Unfortunately, some women may not notice symptoms early. So what can you do to help yourself when you notice this? Make sure, or in order for you to notice this, make sure you need to attend regular antenatal visits. You monitor your blood pressure, and it's going to be definitely recommended by your healthcare provider. And you follow your healthcare provider advice. You seek immediate medical attention if you're experiencing severe headaches, blurred vision, or unusual swelling. You notice this early, it tends to save your life fast and quick. So what is the next problem you might face being pregnant is fear of labor and delivery. As your due time approaches as a woman, you become more anxious, like, oh my god, how am I going to feel? Do I feel okay? Or is this, will labor be painful? Will my baby be okay? Will I be safe? Will I die? Will I survive? What if something is going to go wrong? I know that fear. They are normal. I just want to tell you, they are normal. And what can you do to help yourself? You need to still attend antenatal classes, because without antenatal classes, you won't know what you're doing. So you need to learn about the labor process, what you should notice, and you need to discuss your concern with your healthcare provider, because if you're attending that antenatal class, they're going to tell you what you should be experiencing or you would notice. So the best thing is to attend your antenatal classes. In conclusion, pregnancy is one of the most remarkable journey a woman can experience, but it also comes with challenges. Now, from morning sickness and fatigue to back pain and emotional stress, understanding what is happening in your body and making the journey much smoother. Now remember, every pregnancy is different, okay? My first child can be different from my second child. So listen to your body, attend to your antenatal appointments, seek help when something doesn't feel right, and most importantly, be kind to yourself. You are going to push through. I know you will push through. So share this video. Thanks for watching. See you in the next.